Good morning, everyone. I welcome you all uh, to the LIBF Expo 2026 in Mumbai. And this is a special expo held for healthcare workers, and it's part of a global convention. I'm thankful to the committee to give me and my wife, Dr. Shrutika, the opportunity to come here and speak to you. This unique convention will bring all streams of healthcare alongside hospital administrators, pharma leaders, and wellness entrepreneurs from India and across the world, across the Lohana diaspora. It will serve as a platform for sharing medical expertise, exploring innovations, and fostering cross disciplinary collaboration for a healthier world.
So the objectives of this convention are to connect doctors, specialties and healthcare professionals from India and abroad. We want to encourage consultation and collaboration, networking, utilizing each other's strengths across disciplines, hospitals and clinics so that together we grow as a community, as a nation, we empower each other. We want to generate employment, entrepreneur opportunities for the youth in medical as well as allied health services. We want to discuss digital health, telemedicine. One of the specialities of the program today is rehabilitation tourism, medical tourism, AI applications in patient care. We want to support preventive medicine, community health, mental well-being, being one of the activities that are being discussed today. And we also want to explore charitable and private partnership to accessible healthcare.
And we have a whole list of panel today, which their expertise is going to enrich you with their knowledge. And I hope there is something for everybody to take home. And before we start, I would like to call upon Dr. Praveen Daya, Chairman Medical Committee, to give us the welcome address.
Good morning, all of you. Uh, as a part of LIBF Expo 2026, Mumbai calling, doctors and pharma healthcare convention, I warmly welcome all of you, please, and especially our guest of honor, Shri Rajesh Bhai Kotecha. He is a secretary, Padma Shri Dr. Rajesh Kotecha ji. He is a secretary of Mantralaya, AYUSH Mantralaya, Government of India, Delhi, and Dr. Sanjay Jivrajani is the president of Gujarat Board of Ayurveda as well as Unani system of medicine, and all of my colleagues, doctors, pharma, this one entrepreneur, and all consultant general practitioner, especially the owner of the hospital, Dr. Ajay Thakkar, Dr. This one Viravani from Jabalpur Hospital, and all our consultant and all GPs are present over here. So I welcome, warm welcome to you. Thank you so much.
Thank you, Praveen Daya, sir, for setting the stone for the meeting. Now, without further ado, let me call upon our first keynote speaker. It is my privilege to call upon Dr. Sanjay Jivrajani. He is the President, Gujarat Board of Ayurvedic and Unani System of Medicine in Ahmedabad. The whole board consists of more than 30,000 doctors, and he is the one handling them. I welcome Dr. Jivrajani on behalf of LIBF to give his keynote address on reimagining the wellness industry, Ayurveda, detox, and health at home.
Good morning. Jai Sri Ram. Jai Jalaram. Jai Dhanvantari. Om Namah Shivaya. LIBF Expo 2026. ગુજરાત બોર્ડ ઓફ આયુર્વેદ એન્ડ યુનાની સિસ્ટમ ઓફ મેડિસિન ગુજરાતમાં 30,000થી ઉપર ડોક્ટરો રજિસ્ટ્રેશન ધરાવતી એકમાત્ર ઓથોરિટી છે અને એવરીથિંગ ઇઝ ઓનલાઈન GBAU.in બધું જ તમારે કોઈ પણ ડૉક્ટરની ઇન્ફોર્મેશન જોતી હોય તો એવરીથિંગ ઇઝ ઓનલાઈન. મોબાઈલ એપ્લિકેશન પણ અમે બનાવેલ છે. કોઈ પણ ડૉક્ટરના ડોક્યુમેન્ટ્સ ક્યાંય ગુમ થાય તો એ પણ રિન્યુઅલ સ્લીપ, એમનો ફોટો આઈડી બધું જ ઓનલાઈન છે. લોહાણા બિઝનેસ સમિટ ના પ્રેસિડેન્ટ, લોહાણા મહાપરિષદના પ્રેસિડેન્ટ સતીશભાઈ વિઠલાણી તથા તેમની ટીમમાં પ્રવીણભાઈ, પિયુષભાઈ, આજે એમને હું ખૂબ જ થેન્ક્સફુલ કહું છું, આભાર માનું છું, અભિનંદન આપું છું, વંદન કરું છું. અહીંયા જે હેલ્થકેર પ્રોવાઈડર આપણા વિશ્વના લોહાણા સમાજમાંથી આવેલ બિઝનેસ ટાઇકુન્સ, એમને પણ હું ખૂબ ખૂબ વંદન, અભિનંદન કરું છું. ખાસ મારા માર્ગદર્શક અને પથદર્શક એવા આયુષ મંત્રાલયના સેક્રેટરી શ્રી અને જેમને આયુષને બ્રાન્ડિંગ કરેલ છે તેવા રાજેશભાઈ કોટેચા અને મેઘાબેનને પણ હું ખૂબ ખૂબ વંદન, અભિનંદન કરું છું. LIBFમાં આપણે આજે વેલનેસ ઉપર વાત કરી રહ્યા છીએ. વેલનેસ વેલનેસ એટલે શું? વોટ ઇઝ વેલનેસ? કોઈને બીમાર થવું જ નથી. આજે મોટામાં મોટો પ્રશ્ન હોય તો હેલ્થ પછી જ તમે કંઈ પણ મેળવી શકો. હમણાં જ આપણે મુંબઈમાં એક એક્ઝામ્પલ જોયું કે 35,000 કરોડની ઇન્ડસ્ટ્રીયાલિસ્ટ જેમને એમનો સન ગુમાવ્યા પછી ખબર પડી કે ભાઈ વેલનેસ ઇઝ એ મોસ્ટ ઇમ્પોર્ટન્ટ. એવું જ અમેરિકામાં જ્યારે પેન્ડેમિક, કોરોના પેન્ડેમિક પછી અનેક લોકોએ પોતાના ડોલર્સમાં રૂપિયા મૂકેલ અને જણાવેલ કે ભાઈ વોટ ઇઝ હેલ્થ, વોટ ઇઝ વેલનેસ. વેલનેસ ઇન્ડસ્ટ્રી, વેલનેસ ક્લિનિક, વેલનેસ હોસ્પિટલ, એવરીબડી નોઝ કે ભાઈ વેલનેસ છે એ જ આપણા માટે સર્વસ્વ છે. આપણા પ્રધાનમંત્રી શ્રી નરેન્દ્રભાઈ મોદીએ 2014માં આયુષ મંત્રાલય આપ્યું અને ગોલ્ડન એરા ઓફ વેલનેસ અને ગોલ્ડન એરા ઓફ આયુષ સ્ટાર્ટ થયું. આ વેલનેસમાં દરેક વ્યક્તિ આવી શકે છે. જેમ કે એક એક્ઝામ્પલ આપું કે આપણે આપણી ગાડી છે એને દર વર્ષે 1 અથવા 2 વાર 10,000 કિલોમીટરે અથવા આફ્ટર 1 યર અથવા આફ્ટર 6 મંથ આપણે એને સર્વિસ કરતા હોઈએ છીએ.
Can't hear? Huh. Sorry for the technical glitches. The screen is still acting up, as you can see. And since this is more of a visual display that he wanted to do for us, I think we'll have to take this lecture later on. And I'm terribly sorry, sir, for this. So I would currently we'll move on with the program, and I will tell Dr. Shrutika to invite our next keynote speaker.
So for the next keynote, let me take the proud privilege of inviting Padma Shri Vaidya, Mr. Rajesh Kotecha, Secretary of Minister of AYUSH of Government of India. He has various publications to his credit. He is also an entrepreneur, and he is going to talk today on the potential of India's leadership in integrative medicine. Welcome, sir.
First of all, I want to compliment and congratulate the LIBF team, the Lohana Mahaparishad team, for organizing such a wonderful event and looking at the across potential of different sectors. One of it is health sector. And to begin with my talk, whenever we talk about the health, we usually slip into the medicine or treatment aspect of the health, but we do not actually look at the health per se. So when we look at the health per se perspective, we can see that largely we stay healthy by following simple rituals, what we know through our traditions. And it is not only in India, but also across the globe. Out of 195 member countries of WHO, more than 170 countries have their traditional medicine practices available. And from 40 to 90% of population is using those practices for their health. And since I am talking in front of the entrepreneur community, already it was introduced that we will be discussing about entrepreneurship. So I would also focus my talk on how much paisa is there into this all potential area of not only providing leadership to the world, but there is a huge potential of integrative medicine in our country and the globe. When we talk about integrative medicine, there is a confusion. We need to define what is integrative medicine, what is integrative health, because it is oversimplified. That integrative health means cross-pathy, or the Ayurvedic doctors would do allopathic practice, or allopathic doctor would do something related to Ayurveda. And there is a lot of silos, lot of confusion about that. So precisely integrative medicine is complementing each other, where patient is at the center. If patient is benefited through some evidence-based therapeutics and practices of health, why not? I want to cite one interesting example that will be probably eye-opening for us. Just last month, I was participating into API conference, American Association of Physicians of Indian Origin conference. Thousands of Indian doctors practicing in America in different fields. It is an association. It's similar to IMA in our country. They have started a vertical of Ayurveda into their API. And they have started education programs for integrative medicine for API doctors. And I was invited for a keynote about this potential. So I'm just mentioning how much is the curiosity, acceptability, and the kind of evidences are coming up about this aspect of the practice. Actually, New Age medicine talks about P4 medicine. P4 medicine is personalized, preventive, participatory, and proactive. So we are now out of the era when patient comes to us and we treat them with some symptoms, looking at their investigation reports and prescribe them some medicine. The health sector is becoming now a package of lifestyle counseling, providing therapeutic intervention, providing inputs about the diet and all other things. And it is not known as P4 medicine. So for P4 medicine, what is the best? The best is these models. I have some statistics. The statistics says that when we add these integrative medicine inputs into palliative care, the quality of life improves substantially for the palliative care patients. When we add the integrative medicine component, yoga, Ayurveda, Panchakarma, to the lifestyle disorders, aging problems, the number of hospitalization is reduced by 60%. And the healthcare cost is reduced by 80%. So those are very interesting figures. What I am trying to convey is that let's look at what are the evidences, what are the use cases, what can be done, what is the future, and why how India is actually a candidate for providing leadership to this aspect of integrative medicine, and also have a lot of and cultivate the lot of potential of the commerce and scaling up into this area. When we look at integrative medicine, there are 4 aspects: the education, research, public health, and clinical practice. I am aware that most of us are clinical practice domain people, experts. But to convince this community, I need to talk something about what high evidences are there in the area of integrative medicine. I would like to cite some examples. Recently, since few years, the Ministry of AYUSH, in association with lot of high-end institutions like Indian Institute of Science, IIT Jodhpur, IIT Delhi, AIIMS Delhi, Institute of Liver and Biliary Sciences, ILBS Delhi, and lot of such TMC. So we have started Center of Excellences into these high-end institutions. When we talk about research in integrative medicine, usually we think about the clinical research. And there are a lot of other aspects of evidence generation. For example, we all know that there is a very good potential in Panchakarma. Sanjay Bhai was mentioning, and his presentation will speak more about that. So Panchakarma therapeutics, an Ayurvedic doctor understands. A patient comes in with lot of hope and complications like neurodegenerative disorders, like multiple sclerosis, Parkinson's. Those patients, in our conventional medicine, we don't have much to offer. But in Panchakarma, the patients usually gets a lot of benefit. How they gets it, nobody knows. The Ayurvedic practitioners understand based on this Karya Karan Siddhanta. But then there should be some mechanistic studies is required. So we have instituted a lot of large-scale mechanistic studies of therapeutics. And these mechanistic studies now came up with a lot of high-end evidences that these therapeutic intervention of yoga and panchakarma actually work on dysbiosis of our microbiome. We all came to know just 15 years back about gut-brain connection. Before that, we did not know about that. But now the gut-brain connection evidence is led to this hypothesis that can these therapeutics be looked at this perspective of dysbiosis? And lot of studies now have confirmed that this therapeutic intervention actually restores the balance of microbiome and work on inflammations. We all know that inflammations is the key of all lifestyle disorders, all autoimmune disorders. So now we understand how it works. So when we look at this possibility, it opens up a big potential of healing, not only for our country people, but for the globe. And from this perspective, I would like to mention that lot of such studies we are conducting on mechanistic studies, preclinical studies, through our Center of Excellences, through partnerships. Like we are doing lot of clinical studies, like gold standard clinical study with ICMR. It includes the anemia, some of the candidate of anemia. We work with the Army, Indian Army for high altitude sickness, or we are working with ICMR for establishing some botanicals to establish them as a globally accepted botanical drugs, like ashwagandha, brahmi, sallaki, all those. We know sallaki, boswellia we know, but we don't know sallaki. So we all know boswellia. What is boswellia? It is an Ayurvedic drug. So from the perspective of research, I would like to also mention how we can translate this into high-end potential. I'm aware that we have medical value travel session, so we will discuss more about that. But I'm just mentioning that medical value travel is a big business in our country, and we are all looking forward for that. But did we know that for conventional medicine, the medical value travel patients come from Nigeria, Bangladesh, Nepal, not from rich countries, and their paying capacity is not much in the terms of dollar. But medical value travel, people coming for Ayurveda, yoga, retreats, Panchakarma, they come from all developed countries. Their average stay is 25 days, and they spend a lot of money. So when we look at the perspective of the earning per person or per capita, this area of wellness tourism, medical value travel in Ayurveda or yoga retreats has a very high value. And I am aware that whoever started this initiative, they have actually started nurturing and capitalizing this opportunity. I would like to cite a couple of examples. One is Medanta. Medanta has started integrative medicine department since long. Now they have a pakka ecosystem where there is a cross referral between each other, and they are doing wonderful job for their patients and also earning a lot of money. The other example is Apollo. Apollo has recently taken over Apollo Ayurveda Hospital Groups. Is a very good hospital groups of NABH accredited Ayurveda hospitals. They started their vertical of integrative medicine on all Apollo hospitals recently. So these are the examples. मैं जो कहना चाहता हूँ कि आप जरा देखो आपकी बस कहीं निकल ना जाए, आप भी जरा देखो what is the opportunity behind that. Actually, I also want to mention some more use cases, how we can look at that possibility. One of the possibilities, recently WHO has notified, published the ICD-11 code of Ayurveda, Siddha and Unani, morbidity codes. It's like these codes are, actually a bridge between understanding. If I am an Ayurvedic doctor and if you are a pulmonologist, so we can talk with each other through this coding system. हम जिसको प्राणवश स्रोतस दृष्टि कहते हैं, उसको आप क्या कहते हैं वो आपको देख लो, हम भी समझ जाएंगे आप क्या कहते हैं. It also facilitates electronic health record, large scale evidence generation and so many other things. So this is one thing. Second thing, that recently Government of India has initiated lot of free trade agreements. We just signed EU free trade agreement just last week. This week only, week is not closed now. So in this agreement or agreement with New Zealand or agreement with Australia, all bilaterals, agreement with Dubai, UAE, all bilateral agreements, there is a component of traditional medicine and integration. So our graduates, our degrees are now valid in those countries and they can go there and practice. Vice versa. It opens up the possibility of insurance portability. So the insurance, medical insurance of those countries, they can avail the insurance facility because of the portability in our country by coming here and availing these wellness services, integrative services, which is also a great thing. There are a couple of more examples. Like in NCI Jajjar, National Cancer Institute by AIMS, we have integrative medicine department. In NIMHANS, National Institute of Mental Health and Neurosciences, Bengaluru, there is an integrative medicine department where the professor is of Ayurveda, the associate professor is from yoga, and assistant professor is from psychiatry. And they work together and they offer these services. For example, if a patient comes with endogenous depression, so they need immediate medication, so they start with that medication, some adjuvant Ayurveda and yoga. Slowly they work together and these medicines are withdrawn and patient is only on Ayurveda and yoga. Eventually patient is only on yoga. So they have published lot of such research publications into their domain. One of the interesting thing is that I'm not just talking. I just want to mention some interesting statistics again. Last year we have this NSSO survey, National Sample Survey Organization did an AYUSH survey, and in this survey they found, not we, because if we do it, it is biased. They found that 95% of rural population and 96% of urban population in our country, they are aware about AYUSH practices and 50% of them are using those things for their health. So there is a strong undercurrent. What I am trying to convey is there is a strong undercurrent. We cannot ignore this. We are allied people, we speak English, and we don't know what is ground reality. So because it's a culturally culturally accepted system. So we need to look at the potential of how we can capitalize this. Another thing, that there was a specific question, how much do you spend? If you ask how much do you spend, it is a direct question and it has a possibility of bias. So the question was, do you spend more than 1,000 rupee or more for these services? And out of this, 50% said yes, we spend more than 1,000 rupee or 1,000 rupee per year. It becomes 70,000 crore rupee. When we just extrapolate, it becomes 70,000 crore rupee. And we also had another survey, another study by some organization. RIS is a autonomous institute of Ministry of External Affairs. They did a study for us. How much is the size of the sector? So in 2014, the sector size was less than $3 billion. In 2020, it became $18 billion. And as per the projections, in 2024, it became $24 billion. So from 3 billion, less than 3 billion to 24 billion, it becomes 8 times. So friends, आप कहाँ हो? जरा देखो, इसमें बहुत मोटा पैसा है. इसलिए जरा देखो इसको. I'm just mentioning it because it's not. I'm not just mentioning के पैसे क्या करना हो, लेकिन this is the future. All over the world, the integrative medicine market is growing like anything. It is as of now $5 trillion size, and we are not contributing much, but we can do it if we look at this possibility and make sure that we don't have much differences, because this interpretation of integrative medicine should be taken off. उसमें से बाहर आना पड़ेगा. तब जाकर के हम ये जब आप ही वाले करते हैं मिल करके काम, तो हम क्यों नहीं कर सकते? उसको कैसे नहीं कर सकते? उस पर एक बार हमें मंथन करना चाहिए. Largely and lastly, I am aware that my time is only 2 minutes more. So there are some way forward that I would like to cite. One is, we all should look at this potential of India as emerging as a global hub for wellness and integrative medicine. Because even WHO has established a traditional medicine center of WHO in Jamnagar, Gujarat. It is supported by India, but it's a UN office. And recently WHO has, and Government of India, together they have released Global Traditional Medicine Library. And usually when we talk about traditional medicine, we say, oh, अच्छा है, 5,000 साल पुराना है. लेकिन आपको evidence generate करना होगा. What we are talking about evidence, in this library, we have 1.6 million publications cited there. Out of that, 77,000 is from India. Ayurveda, yoga and other Ayush systems. Majority is Ayurveda and yoga. So there is enough evidences. Now we have to act. We have to translate those things into our practice. The other way forward, we should look at the possibility of cross-referrals and clinical collaboration. There is now a pipeline ecosystem that DGHS AYUSH has published standard treatment guidelines for musculoskeletal, for neurological disorders, for lifestyle disorders. And these guidelines are prepared by sitting together. These guidelines are vetted by orthopedic surgeons, neurologists, and all other specialists. So it is available. It is in public domain. कब किसको कहाँ refer कर रहा है, इसको हम समझ जाए, then it is the key. Third thing, we have to generate more and more evidences. Our Prime Minister always says, work on evidence, look at more and more high-end evidences, and this is the key. And also research partnerships. For research partnerships, there is a facilitation by ICMR. Recently, they have modified their ethics guideline, where the Ayush medicine and other therapeutic research is now possible into high-end big medical institutions, because there is a facilitation ethics committee guideline. There should be 2 experts of Ayush in this ethics committee. That is a facilitation. Fourth, we have to look at capacity building, expansion of capacity building, and integrative medicine education. I want to mention that NMC, our National Commission of Indian Medicine, National Commission of Homeopathy, they have started working together, sitting together and finding out the modalities, what can be done. Advanced people-centered healthcare aligned with universal health coverage and SDGs. That is our goal. And last, platforms like LIBF, because this is a group of people of all experts, not only doctors, not only allopathic doctors, all doctors, pharma, the medical professionals, all are sitting here. So look at this possibility. Such platforms actually can enhance the global dialogue, partnerships and innovation. Thank you so much.
Thank you so much. I loved the talk delivered by Vaidya Shri Rajiv Kotecha ji, because it is an eye opener. See, as Indians, I think sometimes we like to ape the West only. Whatever they like, when they say yoga is good, we believe yoga is good. But I like the statement that he made कि गाड़ी कभी छूट नहीं जाए. हम लोग in aping West, we might forget what we have. We have like this whole treasure of integrated medicine, AYUSH, and we don't need WHO or United Nations to tell us कि ये सच में useful है. So thank you so much for that talk, and I request our trustee Janak Thakkar ji to felicitate sir. Thank you, sir.
Thank you, sir. And after this talk, setting the tone for the meeting, I would again like to re-invite Dr. Sanjay Jivrajani to give the talk on keynote on reimagining wellness industry, Ayurveda, detox, and health at home. Sir.
I forgot to show you this booklet. Is a From Roots to Global Reach is a publication of 11 years of AYUSH. And this is available electronically on the website of AYUSH Ministry. And I will request you to look at this, and download this. What I said, there is much more information about this possibility and what Government of India is doing about in this book. Thank you.
Please. Again, thank you, Rajesh bhai. Integrated અને વેલનેસ ઉપર ખૂબ જ સરસ માહિતી આપી. જય શ્રી રામ, જય જલારામ, જય ધન્વંતરી, ઓમ નમઃ શિવાય. અગેન LIBF 2026 વિશ્વમાંથી આવેલા લોહાણા સમાજના બિઝનેસ ટાઇકૂન્સ, મેડિકલ હેલ્થકેર પ્રોવાઈડર, ડૉક્ટર્સ, ફાર્માસ્યુટિકલ્સ કંપનીના દરેકને વંદન કરું છું, અભિનંદન કરું છું. આ ઓર્ગેનાઇઝ કરનાર ટીમ લોહાણા મહાપરિષદ સતીશભાઈ વિઠલાણી, પ્રવીણભાઈ, પિયુષભાઈ તથા સમગ્ર ટીમને કોંગ્રેચ્યુલેટ કહું છું. ધ સ્કોપ એન્ડ ઓપોર્ચ્યુનિટી ઓફ વેલનેસ, આજે આપણે એની ઉપર વાત કરીશું. ગુજરાત કાઉન્સિલ ઓફ આયુર્વેદ, only one authority for Ayurveda and Unani doctor registration in Gujarat state. More than 30,000 doctors in Gujarat are registered in this council. 2009માં 9 કોલેજ હતી, આજે 2025માં 45 કોલેજ ઇન ગુજરાત છે. ડ્યુ ટુ આયુષ મંત્રાલય, આપણા પ્રાઇમ મિનિસ્ટર શ્રી નરેન્દ્રભાઈ મોદી અને આયુષના સેક્રેટરી રાજેશભાઈ કોટેચાની અવિરત મહેનત આમાં ઘણું બધું કામ કરી ગઈ છે. એને કારણે જ મોર દેન 30,000 ડૉક્ટર્સ છે આજે આપણી પાસે ગુજરાતમાં, અને ઇન્ડિયામાં તો એના કરતાં પણ લાખોમાં આંકડો છે. ગોલ્ડન એરા ઓફ આયુષ એન્ડ વેલનેસ, પ્રાઇમ મિનિસ્ટર શ્રી 2014માં આયુષ મંત્રાલય આપ્યું ત્યારથી ગોલ્ડન એરા ઓફ આયુષ એન્ડ વેલનેસ અને મોર ઓપોર્ચ્યુનિટી ઇન ધીસ ફિલ્ડ. આયુષ મંત્રાલય જે પદ્મશ્રી રાજેશભાઈ કોટેચા જેમને આયુષને બ્રાન્ડ બનાવી, સાહેબનું સપનું હતું નરેન્દ્રભાઈનું કે આયુર્વેદ હર ઘર આયુર્વેદ, ઘર ઘર આયુર્વેદ, હર ઘર સ્વદેશી, ઘર ઘર સ્વદેશી, આત્મનિર્ભર ભારત. એમને જેમને આગળ લઈ જનાર છે તે બ્રાન્ડ આજે જે 10 વર્ષ અને હજી પણ 20 વર્ષ પછી પણ આપણે જોશું કે પદ્મશ્રી રાજેશભાઈ શું કામ કર્યું છે આમાં, એટલું આયુષમાં કામ થયું છે. વેલનેસ ઉપર અનેક કોન્ફરન્સ ગુજરાતમાં થતી હોય છે અને વેલનેસ ઇઝ મોસ્ટ ઇમ્પોર્ટન્ટ એરા. આજે આપણે લોહાણા સમાજ છે એ બિઝનેસમાં આપણા બ્લડમાં છે અને વેલનેસમાં એટલી ઓપોર્ચ્યુનિટીઝ છે. રાજેશભાઈ જે ઘણી વાત કરી ઇન્ટિગ્રેટેડ એન્ડ વેલનેસ. વોટ ઇઝ વેલનેસ? સ્વસ્થસ્ય સ્વાસ્થ્ય રક્ષણમ, એટલે કે તમને રોગ જ ન થાય, બીમાર જ ન પડો, ફ્રી ફ્રોમ ડિસીઝ. આજે લોકોનું એક સપનું હોય છે કે ભાઈ મારે હેપીનેસ જોઈએ છે, હેલ્થ જોઈએ છે, ફ્રી ફ્રોમ ડિસીઝ. ઇટ્સ એ વેલનેસ. તમારી કાર છે એ આપણે જોતા હશું કેટલું આપણે ધ્યાન રાખતા હોય કારનું, કે સર્વિસમાં મોકલીએ તો 10,000 કિલોમીટર થઈ, 1 વર્ષ થયું, 6 મહિના થયા એટલે આપણે એક્ઝેક્ટલી ફોન આવી જાય. એવું જ આપણે વેલનેસમાં ફોન આવવો જોઈએ કોઈ પણ હેલ્થ પ્રોવાઈડરનો કે ભાઈ તમારે 6 મહિના થયા છે, ડિટોક્સ કરો, પંચકર્મ કરો. ઘરે ઘરે 25 વર્ષથી માંડીને 40, 50 અને 80 વર્ષ સુધી દર વર્ષે 2 વખત વેલનેસ યાની ડિટોક્સ થવું જોઈએ. જેવી રીતે આપણું કારનું આપણે ધ્યાન રાખીએ છીએ પણ આપણે આનું ધ્યાન નથી રાખતા. આતુરસ્ય વિકારમ પ્રશમન ચ એટલે કે ઇલનેસ ટુ વેલનેસ. આપણે વેલનેસની વાત કરશું. ફ્રી ફ્રોમ ડિસીઝ, આપણે જે ડેફિનેશન ઓફ વેલનેસ, કોઈ પણ રોગમાંથી આપણે મુક્ત થવું છે અથવા રોગ જ નથી થવા દેવા. ટોક્સિન્સ આપણા બોડીમાં, ડિટોક્સ. સ્વસ્થ ભારત અભિયાન, આખું ભારત આપણું હેલ્ધી હોય તો આપણે 2047માં વિકસિત ભારત બની શકીએ અને હેલ્થ હશે તો જ હેપીનેસ હશે. આજે તમે જોયું હશે ઘરે ઘરે તમે ક્યારેય કોઈ બીમાર હોય એક ઘરમાં તો આખું ફેમિલી, કદાચ કરોડોનું સામ્રાજ્ય હોય તો ડિસ્ટર્બ હોય. ચોઇસ ઓફ પેશન્ટ, વેલનેસ ઇઝ એ હેલ્ધી પીપલ, ચોઇસ ઓફ પેશન્ટ ફોર ડિસીઝ. એમાં આયુર્વેદ, એલોપેથી, હોમિયોપેથી, દરેક પેથી છે પોતપોતાનું સાયન્સ છે અને દરેક પોતપોતાની રીતે એકદમ શ્રેષ્ઠ કામ કરી રહી છે. એલોપેથી ઇઝ ગુડ ઇન સર્જરી, ઇન ઇમરજન્સી, નોન કોમ્યુનિકેબલ ડિસીઝ. મેઇન સ્વસ્થ ભારત અભિયાનમાં આપણે આયુર્વેદ, હોમિયોપેથી, એલોપેથી, એક્યુપંચર, સુઝોક, વિધાઉટ મેડિસિન ટ્રીટમેન્ટ. આજ તમે ઘણાને સાંભળ્યા હશે 70 વર્ષથી હું કોઈ દવા જ નથી લેતો, એક દવાની ગોળી પણ ના લીધી હોય, આપણે એને સુખી ગણી શકીએ, હેલ્ધી ગણી શકીએ, હેપી ગણી શકીએ. આપણે એવું ઇન્ડિયામાં, ભારતમાં, વિશ્વમાં એવું દઈ શકીએ કે લોકો એક પણ ગોળી વગર હેલ્થ સપ્લિમેન્ટ ઉપર પણ રહી શકે અને કોઈ પણ ગોળી વગર કોઈ પણ ઇમરજન્સી ના આવે એવું થઈ શકે. પ્રિવેન્શન ઇઝ બેટર ધેન ક્યોર. આ એક રૂલ્સ છે કે કોઈ પણ તમારે રોગ જ ન થાય એના માટે શું વેલનેસમાં કરી શકીએ. આના માટે આઈડિયલ પર્સન છે આપણે વેલનેસ તરીકે. વેલનેસ આઈડિયલ પર્સન એક હતા મહાત્મા ગાંધીજી અને બીજા હું ગણું છું જે નરેન્દ્રભાઈ મોદી, જેમની લાઈફસ્ટાઈલ છે. તમે જોયું હશે કે ડિસિપ્લિન, બહાર જાય તો એમનો આયુર્વેદિક સાત્વિક ખોરાક, ઘરનું જમવાનું, એકદમ ફૂડ, એકદમ એમની લાઈફસ્ટાઈલ, માઇન્ડ, બોડી અને સાઉલથી જે મહાત્મા ગાંધીજી હતા એવું જ આપણા નરેન્દ્રભાઈનું છે કે એમના તેજ દેખાય, એમનું ડિસિપ્લિન, એમની દિનચર્યા, એમની ઋતુચર્યા, એવરીથિંગ ઇઝ ધેર. ઇલનેસ ટુ વેલનેસ. લોકો બીમાર પડે, ઇલનેસ એટલે કે તમે આજે બીમાર પડે ત્યારે તમારે ઇમરજન્સીમાં જવાનું, સર્જરી થાય, હોસ્પિટલમાં એડમિટ થવાનું, લાખો રૂપિયાનો ખર્ચો થાય, આખું ફેમિલી ડિસ્ટર્બ, નોટ ઓનલી વન પર્સન, બીકોઝ ઓફ તમે સર્વિસ નથી કરતા વર્ષમાં 1 કે 2 વાર. એટલે વેલનેસ એટલે ઓલવેઝ તમે તમારું કેર પહેલેથી જ કર્યું. ફ્રોમ પાસ્ટ 2 decades, 20 years, people compromise, ignore their health to earn money. બિફોર પેન્ડેમિક, કોરોના પહેલા લોકો એવું સમજતા હતા કે મની ઇઝ એવરીથિંગ. નાવેડેઝ હેલ્થ ઇઝ એવરીથિંગ. હેલ્થ છે તો મની તો છે જ. વાય અનહેલ્ધી ઇટિંગ્સ હેબિટ્સ, ગમે તે પધરાવાનું કચરા ટોપલીમાં. આપણે કેરોસીન ગાડીમાં આપણે પેટ્રોલની જગ્યાએ કે ડીઝલની જગ્યાએ કેરોસીન નાખી છીએ? નેવર. ઓલાને નાખ્યું હોય તો એ કંઈક તને ખબર નથી પડતી, બે ગાળું દઈએ. અને આપણે અહીંયા એની ટાઈમ ફાસ્ટ ફૂડ, જંક ફૂડ, દરેક વસ્તુ કચરા ટોપલીની જેમ પધરાવી દેતા હોઈએ છીએ. પીપલ આર ઇન સ્ટ્રેસ, લાઈફ, ડ્રીમ, એમ્બિશિયસ, ઇન્કમ, કોમ્પિટિશન. Main reason this. After all, ultimate goal is satisfaction. 3 types of pollution: water pollution, air pollution, food pollution. In this world, એટલે કે હવા, પાણી ને ખોરાક, ત્રણેય વસ્તુમાં અત્યારે પોલ્યુશન છે. આપણે એમાંથી વેલનેસ તરીકે શું કરી શકીએ એના માટે આપણે આગળ વાત કરશું કે આપણી પાસે કેટલી ઓપોર્ચ્યુનિટી છે. અને બિઝનેસ ટાઇકુન્સ, આપણા લોહાણા સમાજ આમાં ઘણું બધું કરી શકે એમ છે. પેન્ડેમિક, પીપલ સાયકોલોજી ચેન્જ ફ્રોમ ઇલનેસ ટુ વેલનેસ. લોકો હેલ્થને સમજવા માંડ્યા કે વોટ ઇઝ હેલ્થ. લાખો રૂપિયા, લાખો ડોલર વિશ્વમાં લોકોએ છોડી દીધા ડ્યુ ટુ કોરોના, કે લોકોને ખબર પડી કે વોટ ઇઝ હેલ્થ, વોટ ઇઝ વેલનેસ. ટાઈપ્સ ઓફ વેલનેસ, જેવી રીતે તમે જોયું હશે અહીંયા બ્રિજ કેન્ડી છે, અહીંયા હિન્દુજા છે, લીલાવતી છે, એવી જ રીતે આપણે વેલનેસ ક્લિનિક, હોસ્પિટલ, રિસોર્ટ્સ, ફૂડ સપ્લિમેન્ટ, હેલ્થ સપ્લિમેન્ટ અને વેલનેસ ઇન્ડસ્ટ્રી, આ વેલનેસના 5 મોડ્યુલ્સ છે. કોઈ પણમાં તમે જઈ શકો છો, ઘણો વેકેન્ટ એરિયા છે કે દરેક સેન્ટર વાઇઝ, દરેક ડિસ્ટ્રિક્ટ વાઇઝ, દરેક સ્ટેટ વાઇઝ રિસોર્ટ્સ હોવા જોઈએ, ક્લિનિક હોવા જોઈએ, હોસ્પિટલ્સ હોવી જોઈએ વેલનેસની. ઓપોર્ચ્યુનિટીઝ ફોર લોહાણાસ. આયુર્વેદ રિસોર્ટ્સ એન્ડ સ્પા, આયુર્વેદ બ્યુટી ક્લિનિક્સ, રેસ્ટોરન્ટ્સ, ચેઇન ઓફ રેસ્ટોરન્ટ, ફ્રેન્ચાઇઝ મોડલ્સ. મેઇન કન્સેપ્ટ આપણો આ છે કે આપણે કઈ રીતે જઈ શકીએ. હું તમને વાત કરું પણ જવું કઈ રીતે, મારી પાસે ફંડ છે, યસ, વેલનેસ રિસોર્ટ્સ, હોસ્પિટલ એન્ડ ક્લિનિક્સ, સ્ટેટ વાઇઝ, ડિસ્ટ્રિક્ટ વાઇઝ અને એવરીબડી. તમે આ ફ્રેન્ચાઇઝ મોડલ્સમાં જઈ શકો છો. એના માટે તમે કોન્ટેક્ટ કરી શકો છો. આપણે એવું ઈચ્છીએ કે ભાઈ ઇન્ડિયા સ્વસ્થ ભારત અભિયાન, હર ઘર આયુર્વેદ, ઘર ઘર આયુર્વેદ, હર ઘર સ્વદેશી, ઘર ઘર સ્વદેશી, એમાં કોઈ પણ આમાં જોડાઈ શકે છે. જેવી રીતે અહીંયા લીલાવતી છે તો એમાં કોઈ ઓનર છે એ અલગ જ છે, ડોક્ટર્સ છે એ ટેકનિશિયન છે, ટેકનિકલ પર્સન છે એ અલગ છે. એમ કોઈ પણ ઇન્વેસ્ટર છે, કોઈ પણ પાર્ટનર્સ છે, ક્લિનિક છે, હોસ્પિટલ છે, એ બધું રન કરી શકે છે. બીકોઝ વી હેવ મોર દેન 30,000 ડોક્ટર્સ ઇન ગુજરાત એન્ડ મોર દેન લાખ્સ ઓફ ડોક્ટર્સ ઇન ઇન્ડિયા. આપણી પાસે જે ટેકનિકલ પર્સન છે એ ઘણા બધા છે, એમને એ નથી આઈડિયા કે ભાઈ એમને કઈ રીતે માર્કેટ કરવું અથવા શું એમને કરવું. એમને ટેકનિકલી બધું આવડે છે. વેલનેસ, લોહાણા કોમ્યુનિટી, હોસ્પિટલ ઇન ડિફરન્ટ સિટી, ઓપીડી ક્લિનિક, રોલ મોડલ, ફ્રેન્ચાઇઝી, ઇન્વેસ્ટર, હેલ્થ રિસોર્ટ. 4 છે, માર્કેટિંગ, મેડિકલ, ફાઇનાન્સ ને ઇન્ફ્રા. રિસોર્ટ્સ માટે એવું અલગ અલગ ક્લિનિક, હોસ્પિટલ માટે છે. તમે એક નહીં પણ તમે 10 ક્લિનિક, 20 ક્લિનિક, 100 ક્લિનિક, 100 હોસ્પિટલ આખા ઇન્ડિયા લેવલમાં ઘણું વેકેન્ટ છે. ઇટ્સ અ ડિટોક્સ. ડિટોક્સ જરૂરી છે. એવરીબડી નોઝ વોટ ઇઝ ડિટોક્સ. તમારે એક ફેરે તમારું શોધન કરવું જોઈએ. જેમ સાહેબે વાત કરી પંચકર્મ, રાજેશભાઈએ વાત કરી પંચકર્મ, એવરીબડી નોઝ પંચકર્મ. દરેક જિલ્લામાં દરેક વ્યક્તિએ ઘરે ઘરે એવરીબડી 25 વર્ષથી માંડીને તમે લાઈફ ટાઈમ સુધી વર્ષે 1 વાર 2 વાર તમારે ડિટોક્સ બોડીને કરવું જોઈએ. તો તમે દવા વગર જીવી શકશો. તમારે ક્યાંય ઇમરજન્સી નહીં આવે, તમે હેપીનેસ મેળવી શકશો, હેલ્થ મેળવી શકશો. મોર ઇક્વિપમેન્ટ્સ, ઇન્ટરનલ ઇન્સ્ટ્રુમેન્ટ, આ બધી જે કંઈ આમાં પણ આપણે પછી કામ કરી શકીએ. વેલનેસ ઇન્ડસ્ટ્રી એઝ અ ઓપોર્ચ્યુનિટી સ્પેસ ફોર ઇન્ડિયા. વાય વેલનેસ ઇન્ડસ્ટ્રી? ગ્લોબલ વેલનેસ ઇકોનોમી 6.3 ટ્રિલિયન ઇન 2023. આ એક ડેટા છે કે 2003માં ગ્લોબલ વેલનેસ ઇન્ડસ્ટ્રીનો 6.3 બિલિયન ટ્રિલિયનમાં આનો બિઝનેસ છે. અને પાછું આમાં બ્લેસિંગ્સ પણ છે, નોટ ઓનલી બિઝનેસ, ઇટ્સ અ બ્લેસિંગ્સ. $2033 બિલિયન 8370. આપણે આ આંકડામાં ના પડીએ પણ એટલું ગ્રોથ છે, એટલો પોટેન્શિયલ છે આ એરા. Due to COVID-19, people are understanding the importance of health and immunity. Because of this, healthcare industry will grow. Importance of immunity. દરેક વ્યક્તિએ ઇમ્યુનિટી પાછળ જવું જોઈએ. ઇમ્યુન સિસ્ટમ હાઈ હશે આપણી, આપણું જે ડિફેન્સ હાઈ હશે તો આપણને કોઈ ટચ નહીં કરી શકે. બોડીની ઇમ્યુન સિસ્ટમ જેવી રીતે આપણે કારની ઇમ્યુનિટી રાખીએ છીએ દર વર્ષે, એ જ રીતે એવરીબડી ઇઝ શેરિંગ ધ વે ટુ ઇમ્પ્રુવ ઇમ્યુનિટી. મિનિસ્ટ્રી ઓફ આયુષ આમાં ખૂબ જ ઉકાળા પેન્ડેમિક વખતે, આપેલા કોરોના વખતે ઘણા બધા આયુષમાં રાજેશભાઈ એટલું કામ કરેલું ત્યારે આજે 10 વર્ષ પછી લોકોને ખબર પડશે કે વોટ ઇઝ ઇમ્યુનિટી. એવરીબડી ઇઝ શેરિંગ. આજે તમે ટીવી ચેનલ ઉપર જોશો તો ઘણા બધા કહે છે વોટ ઇઝ ઇમ્પ્રુવ ઇમ્યુનિટી. ઇમ્યુનિટી ઇઝ મોસ્ટ ઇમ્પોર્ટન્ટ. વોટ ઇઝ બેટર ટુ સ્પેન્ડ ઓન હેલ્થ સપ્લિમેન્ટ ઓર મેડિસિન? તમારે મેડિસિનમાં જવું કે હેલ્થ સપ્લિમેન્ટ? ઓલવેઝ હેલ્થ સપ્લિમેન્ટ. ઓબ્વિયસલી ઓન હેલ્થ સપ્લિમેન્ટ. 80% on health supplement. Boost your immunity with ashwagandha, guduchi, cow milk, A2 milk, cow ghee, wheat germ, superfood, curcumin, etc. અશ્વગંધા ઉપર આયુષ મંત્રાલય ખૂબ જ મોટું કામ કરી રહ્યું છે. રાજેશભાઈને ખબર જ છે, એમના થ્રુ જ બધું થઈ રહ્યું છે. જેવી રીતે વૈશ્વિક કોરિયન જીનસેંગ છે, એવી જ રીતે અશ્વગંધાનું એટલું માર્કેટ મોટું થાય અને લોકો અશ્વગંધા ઘરે ઘરે લે, એવો પણ આપણે એવો કંઈક કન્સેપ્ટ પણ આગળ મૂકી રહ્યા છીએ. વેલનેસ માઇન્ડસેટ, યુઝ સેવિંગ છે. ઇલનેસમાં તમારે લાખો કરોડો રૂપિયા કદાચ અમુક ટાઈમમાં જ દેવા પડે. વેલનેસ માઇન્ડસેટ પર ડે તમે 100 to 200 રૂપીસમાં, અને દર વર્ષે તમે 10-20 હજાર રૂપિયામાં વેલનેસ માઇન્ડસેટ. પ્લસ એમાં તમારો આખો પરિવાર આનંદ કરે છે, ચ્યવનપ્રાશ ખાય છે, આખી ઇમ્યુનિટી સિસ્ટમ સારી કરે છે. એમાં તમારો આખો ફેમિલી ડિસ્ટર્બ થાય છે ટોટલી. આ ઇટ્સ એ વેલનેસ. પ્રિવેન્શન ઓફ ઇલનેસ ઇઝ વેલનેસ. Illness is costly, wellness is cheaper. Shift in mindset, illness to wellness mindset. હમણાં 2025નો લાસ્ટ ડેટા છે, યુએસડી આપણો ઇન્ડિયાનો, ઇન્ડિયન વેલનેસ ઇન્ડસ્ટ્રી, યુએસડી 72 બિલિયન. અને હજી મલ્ટીપ્લાય થવાનું જ છે આ, પ્લસ બ્લેસિંગ્સ. ઇન્ડિયા વેલનેસ માર્કેટ, ગ્રોથ એન્ડ ગ્રોથ. ન્યુટ્રિશન, બ્યુટી, રિજુવિનેશન, કાઉન્સેલિંગ, ફિટનેસ, સ્લિમિંગ, એલોપેથી સપ્લિમેન્ટ્સ ઓલ્સો, અલ્ટરનેટિવ થેરાપી. 5, 10, 20 યર્સમાં ગ્રોથ એન્ડ ગ્રોથ. ઇનકમિંગ યર વેલનેસ ઇન્ડસ્ટ્રી, એક મેગેઝિનનો સર્વે છે આ, 3 લાખ કરોડ ઇન્ડસ્ટ્રીઝ. એક્સપોર્ટ, જેમાં રાજેશભાઈ હમણાં વાત કરી કે આપણે વિશ્વમાં ગમે ત્યાં ગમે તે એક્સપોર્ટ કરવું હોય તો એના માટે ટ્રેડિશનલ સેન્ટર આપણા જામનગરમાં WHO એપ્રુવડ થઈ રહ્યું છે કે તમે તમારી ક્વોલિટી દવા, એના રિપોર્ટ્સ, વિશ્વમાં કોઈ તમારી દવાને અટકાવી ન શકે. મોટામાં મોટો પ્રોબ્લેમ હતો કે ભાઈ તમે NRI લોકોને કઈ રીતે દવા આપવી, એના બધા એના આઈડલ બધા જોવે, FDA એપ્રુવડ છે, આ તે. બધી વસ્તુઓ ક્લિયર કરી છે એકદમ. એટલે તમે એક્સપોર્ટ પણ એટલું કરી શકો છો. આયુર્વસ્ત્રો, આ અત્યારે જે ફોરેનમાં એક કલ્ચર છે કે ભાઈ ફેબ્રિકને કારણે સ્કિન ડિસીઝ થાય છે, કેન્સર થાય છે, તો એમાં પણ સારો ઓપોર્ચ્યુનિટી છે. નીમ છે. આયુર્વેદ ફાર્મિંગ મોસ્ટ ઇમ્પોર્ટન્ટ. આપણી પાસે રો મટીરિયલ જોશે, જેને ઇન્ટરેસ્ટ હોય આમાં પણ જઈ શકે છે. બહુ સરસ છે. આમળા, એલોવેરા, અશ્વગંધા, બ્રાહ્મી, મુસલી, કોચા, ETC. ઘણો બધો ઓપોર્ચ્યુનિટી છે આમાં. મેડિસિન, આપણી હેલ્થ સપ્લિમેન્ટની મેડિસિન છે. જે ડિજિટલ હેલ્થ એના માટે છે કે જે એવિડન્સ બેઝડ ડેટા. આપણે વાત કરશું વેલનેસ કે ભાઈ હું દર વર્ષે 2 વાર કરાવું છું તો મને સારું ક્યાં થયું, તો એનો ડેટા, એવિડન્સ બેઝડ ડેટા, જે આપણા પ્રધાનમંત્રી શ્રી અને આપણે આયુષ મંત્રાલય પણ એમ કહે છે કે તમારી પાસે ડેટા, એવરીથિંગ ઇઝ ધેર. વિશ્વને તમારે કન્વિન્સ કરવું હશે તો ડેટા જોશે. AYUSH, નેટ, ઈમેલ, કાઉન્સેલિંગ, આ એના પાર્ટ્સ છે, પાર્ટ્સ ઓફ ધી વેલનેસ. ચ્યવનપ્રાશ, ગુલકંદ, આમલા જાંબુ, ઇટીસી પિકલ્સ સુધી એવરીથિંગ. આયુર્વેદ તમે શું આયુર્વેદ ફર્નિચર નીમમાંથી ને એમાંથી તમે ફર્નિચર પણ બનાવી શકો છો. આયુર્વેદિક ફર્નિચર, કેન્ડી, ટોફી, આપણું જે ફૂડ હતું, બેઝિક વસ્તુ હતી, એને જ આપણે ઇમ્પ્લિમેન્ટ કરવાની છે. થેન્ક યુ ઓલ. સ્વસ્થ રહો, ખુશ રહો, મસ્ત રહો.
Thank you, sir. Thank you for the insight into wellness. I'm sure all of us are inspired by your talk. And now I would like to invite Secretary Harish Bhai Thakkar, sir, to felicitate our speaker. Sir,
Moving on to now panel discussion, that is good medicine versus sustainable medicine. Is there a conflict? Let me invite the moderator, Dr. Hardik Bangde. Dr. Hardik Bangde is a senior orthopedic surgeon practicing in Mulund, operates from Shraddha Hospital, Mulund, and in Hiramongi, Navneet Hospital. I would like to say that he's an excellent surgeon, but the speciality of Dr. Hardik is that he believes that if anything can be treated with medicine, then you really don't need to do surgery for that. So I think we need such kind of youth doctors who believe in giving their utmost best to the patients. So I would like to invite Dr. Hardik for this lovely panel discussion.
Thank you, Dr. Shrutika. Good morning, everybody. As Dr. Shrutika said, our next session is a panel discussion, and the topic is good medicine versus sustainable practice. Is there a conflict? Now, as medical students, we were taught in medical college that how to diagnose a disease and prescribe the treatment. So disease treatment, life was simple. But once we stepped out of medical college and into the real world, it wasn't just about disease and treatment anymore. A third factor came into play, named finances. And suddenly, life was not as simple as before. Because medical practice needs ethics, of course, but medical practice also needs hardcore finances, and there's no running away from it. So, when the Hippocratic Oath and the checkbook pull you in completely different directions, what do you choose? And how do you choose? Good morning, everybody. My name is Dr. Hardik Bangde, and we'll be discussing this complex dilemma today with our 6 panelists. Please welcome on stage.
yeah, I'm sorry to interrupt. I would like to welcome our chairman, Mr. Satish Vitlani sir. Thank you, sir. Welcome, sir. You want to? I would request you to come on stage to say a couple of words. Okay. Thank you, sir. Thank you. Thank you, Hardik.
So, we'll continue. Please welcome on stage our panelists for today's panel discussion. Dr. Dilip Raja, Dr. Tushar Jimulia, Dr. Himanshu Thakkar, Dr. Mayur Thakkar, Dr. Dwani Gesota, and Dr. Nidhi Dakshini. I'll give a brief introduction about all our panelists. They are all very, very big names in their own fields. Dr. Dilip Raja is a senior urologist and andrologist practicing in Mumbai since the past 35 years. He has been a gold medalist and has trained at Belgium, USA, and Australia. Apart from his own urology center at Bandra, Sir practices at Saifi Hospital, Khar Hinduja Hospital, and Breach Candy Hospital. Dr. Tushar Jimulia, sir, is a senior orthopedic surgeon with an experience of more than 30 years in India and the UK. Sir is attached to Khar Hinduja Hospital, Bharatiya Arogya Nidhi Hospital, Criticare Hospital, and specializes in joint replacement and arthroscopy. Dr. Himanshu Thakkar is a senior ENT surgeon from Rajkot. practicing since the past 23 years, and he has his name written in the Limca Book of Records thrice, and also in the India Book of Records. He has received multiple awards from the Indian Medical Association and has served as the president of the ENT Society of Rajkot. Dr. Mayur Thakkar is a consulting neurologist with over 10 years of experience. He is assistant professor of neurology at the prestigious GS Medical College in Mumbai, and he has special expertise in epilepsy and has managed more than 5,000 patients with drug refractory epilepsy. Dr. Dwani Gesota is a pediatrician and child and family therapist. She is associated with Jupiter Hospital's PICU and NICU. She practices in Mulund and has online consultations from Dubai, USA, and Africa. Our panel contains not just experience but youthful exuberance as well. The youngest panelist for today's discussion is Dr. Nidhi Dakshini. She is a former ICCU resident at Fortis Hospital, Mulund, and is currently pursuing MD Emergency Medicine at Vedanta Hospital. Welcome, everyone. Dr. Dilip Raja, I'll start with you. In the earlier days, the doctor-patient relationship was extremely important. How much the doctor cared for the patient and how much faith and loyalty the patient had towards the doctor mattered the most. But today, private practice also needs to cater to financial targets and deadlines, especially at corporate hospitals. Is good medicine and the emotional connect with patients still possible under a corporate billing structure?
Good morning, and thank you, first of all, Hardik. And before we begin, I would like to express my thankfulness and gratitude to LIBF President Satish Bhai, under whose guidance the entire function, which I've seen it growing over a period of years, is just amazing and out of the world. Satish Bhai, Piyush Bhai, Janak Bhai happens to be my brother-in-law as well. And it's an amazing, some of you I'm sure are involved into it, but those who are seeing it for the first time, you have no idea where it began from. It began from such a ground level that it was a kind of an impossible. Today the dream is just magnanimous. Thank you, Satish Bhai and the team. It is an excellent job. Now, talking about a very sensitive topic which Dr. Hardik has raised is ethics. Ethics is not dead as yet. Ethics is still there. Ethics and finance are not to be connected. They are not controversial with one another, but they are complementary to one another. If ethics is not there and if it is only finance is there, then the whole medical science and the treatment will collapse. So I think ethics is a part and parcel of the treatment, I'm saying, because we are a social body. And we need to treat that, and not only the medically, but even educationally, socially, personally, financially, and every other way. What really matters is, are we really doing the good? Because what you said is some of the corporate hospitals have come in and the culture is changing. Yes, corporate hospitals will come in and they are there. They will change the financials. So what happens really, the incentives changes. But it is up to every individual doctor to maintain his own conscience alive and ethics alive is one of the most important parts. And there is no harm, no administrator, no authority, no medical superintendent director will prevent you from practicing ethical medicine. Do not allow as we all know that every human being has two seeds, good and the bad. Whichever one you are feeding more is going to grow more. So if you are going to just go after the money, trust me, you are asking for a disaster. Keep your medicine ethics clear, advise correctly, and maybe late. Maybe it will take some time for people to understand you, but they will, and they will definitely be. It's a big, long topic. I can go on talking for hours together on this, but that is not the thing. But I think ethics go simultaneously with finance, and there is no need to separate them two, but make them complementary with one another.
Right. I think he's spoken like a true blue medical practitioner with 35 years of experience. So I think he makes the best of both worlds. Dr. Dwani, I'll come to you. Sir has spoken like a senior practitioner, but as a young practitioner, you're building from the ground up. And so, does the pressure to be sustainable or that is profitable ever feel like it is in direct conflict with the way you were taught to practice in the medical college?
Interesting question. Thank you for that. Um, I would like to say that as a budding practitioner, I don't think that sustainability and profitability are on the other side of the spectrum. I think both of them can go hand in hand. That is because, like Sir said, like we should know and choose which seed that we should water, right? So I picked the seed of watering children and watering the families through the mother. So there is this quote in Marathi which says that Mulgi Shikli Pragati Zali. So if you train one woman, the entire family is understanding the concept of health, why it is important. I talk about mental health in pediatrics, and like you said, that corporate hospitals usually are not going towards understanding the emotionality part of it. So Mr. Ajay Thakkar, sir, doctor, he has been kind enough for me to extend my work to the NICU, to the PICU, so that we prevent, like Mr. Kotecha had said, that now the time is about prevention rather than treating. So I am preventing postpartum depression by working through corporate setups and through my private practice as well. And if we keep our entire work as sustainability driven, our entire focus is like that, so if I train a mother and if I train a family, what happens is the entire generation is getting treated and they are preventing illnesses because of this. So sustainability is also about how long you can sustain. And if that is your goal, then I think profit is just a byproduct of it.
But let me come back to you. Your wise words, of course,
Yeah.
but how much of this has been taught in medical school?
Oh, of course not. Of course not. I think there should be a bridge between this. That is why, after me completing my MD in pediatric homeopathy, I thought that there is such a big lag in understanding the psyche of the patient. So that is why I pursued courses in narrative therapy for children. I also pursued a course in adolescent problem solving counseling technique. Now, if God's grace, I want to learn more and more in this. So apart from our main practice of medical school, I think we should understand what is happening in the society, and then we should equip ourselves so that we come together and we can provide better to the society. And one thing that I loved from Mr. Kotecha's talk was that now we are not supposed to see it separately. Everything has to come together. So Britishers came to us and they had a very prominent rule of divide and rule. But today, with Sir's guidance and this organization of LIBF, I would like to take the opportunity that I learned something, that now Lohana community is now going to teach, that we are going to come together. So we are going to unite and rule.
Right, sure. So I think we've started on a nice mellow note for the panel discussion, but I think we should spice it up a little bit. So I'll ask Tushar sir now, a controversial question maybe. Sir, what is the biggest lie we tell medical students about the future and the business of being a doctor?
I don't know why I have the question. I'm not a businessman. Fortunately or unfortunately, there are no medical students here. So we are all on this side of the fence. We all have lived the lie.
Oh, there is a student on our panel.
Yeah,
So.
but she's already postgraduate. So what I feel is, medical ethics. Medical students need to be told that the entire what they are taught is a white lie. Medical is not a noble profession. You have to live, you have to earn, you have to sustain your family. Good medicine versus sustenance. If you want to sustain your life as a professional, you have to be good, you have to be ethical. So if you are good, you will sustain your practice, you will live your life. This thing of noble profession, you will have everybody giving you blessings, thank you, gratitude, does not feed your stomach. You have to have your finances in place, whether you have inherited it, great, lucky. If not, you have to start from scratch, start from beginning. So we have to think of the financial side, what you started off. We have to accept that there will be a cost to the patient, there will be affording patients, there will be non-affording patients. You can play Robin Hood, you can take more from the affording, give the non-affording. Fair enough, all these ways are working. You need to make sure that at the end of the day, your own setup, everybody is not in corporate, your own setup, your own clinic, if you don't earn, we are not Vodafone, nobody is going to sustain us. Nobody is going to keep funding you. You have to somewhere generate money. So
And there is always Airtel looming around.
yes, yes, exactly. And medicine is a business. You buy your place, it's commercial. You pay commercial tax. You pay commercial water rate. You have staff, they want commercial. And out of interest, you work for a charitable hospital, go to a charitable hospital, whether it's Alliance or Rotary or government. The staff is paid, the nurses are paid, the ward boys are paid, only the doctors are undercharging. The doctors have 100 rupees. The hospital takes out of which 50 comes to you. Why doctors? You do a camp, it is a Rotary camp, Lions camp, not Dr. XYZ camp. You are the one who's giving free service. I think we need to come out of the mindset that we are all here for the goodness and the nobleness. Nowadays, ethics is taught in medical colleges. They have a subject. It has come obviously from abroad, but here also it has started. So it will pick on. But the business side, the financial side is not included in the studies. And it takes time, and even after 20 years, 30 years, we are still learning new things every day. I would open it to other panelists for their experience.
So that is exactly why I asked you this question, just to liven up the whole thing. Very strong words indeed. Would anyone on the panel want to give a rebuttal or discuss a few more points on this?
I would like to say something. I come from a SSE school, okay? So when I saw my peers who were from ICSE, CBSE, they already knew about taxation and everything. So I feel that if, of course, from the medical perspective also, nobody taught us taxation. Nobody taught us, managing the finance from the business perspective of it. So schools are failing to do it. Medical colleges are failing to do it. So I like ethics has been a part as a subject in medical curriculum. I feel that I think this perspective should also be added. Perhaps one of the things that sir can also add in the coming forums, I would say. So that then we can have to pick and choose where do we have to draw the line of on which side do we fall.
And just a rejoinder, I mean, how many here would prefer or to avoid a corporate hospital because of the cost? I think people here have paying capacity. Unfortunately, doctors undercharge. They don't value themselves. They don't value your own value. I mean, your own batchmate who's in IIT, he got campus recruitment 1 crore. Which doctor says as an intern, I got a package of 40,000. I mean, what are we playing with? I mean, your own batchmates at the age of 30, they say we are senior executives. I have refused this 2 crore package. It's too less for me. I mean, most doctors' careers start at 40, as if you're a postgraduate. Let's wake up to reality. I think if you are willing to charge, patients are willing to pay. There will be a section who cannot afford. You can subsidize their treatment. There are social organizer donations. You don't need to do it. No jeweler gives free jewelry to a poor patient, poor person. Tere beti ki shaadi hai. But a doctor is expected to give free.
True.
No builder gives a free flat to a doctor also. Forget poor people. I would rather earn and then do charity.
Right. I agree with.
I think I agree with Tushar and Dr. both of them. And to this extent, we have been talking this for many, many years, that the finances should be included somewhere in the curriculum, which is not. But what is happening now in most of our national as well as the international conferences, we almost have a half a day discussion on this financial aspect. We have separate sessions, separate conference, like how we are having a lot of places where having meetings on AI, half a day session. Now we have sessions in our most of the meetings on the finance. And trust me, I wish I would have gained that knowledge 30 years, 40 years ago. But whatever has happened, I can't unwind the clock. But I think for the next generation coming up, just because the pressure of finance is coming, ethics is not to be mistaken. I agree 100% with that. We have all grown up doing Rotary camps. I was probably one of the first person in the country who had gone to East Africa in 80s. and conducted, in my camp there were 300 patients in the outpatient, and there were 40 surgeries which I did free of charge. And trust me, what was the statement was given to me? He says, Dr. Raja, you're mad. Nobody does so much free work in Kenya and Tanzania today. In those days, I'm talking about. He says, you have come as a god to this country. But trust me, that thing, that camp, that goodwill or whatever you may call it, paid me for the next 10 years. I've seen at least 300 patients per year flying down from East Africa to Mumbai, literally with bag and baggage in the car. Those days are gone, over. I'm not saying that they will ever come back again. But having done good work always pays you back, no doubt about it. Finances are important, 120% is important. When I was going in a bus and this thing, everybody, some of our community person only had told me, I said, Dr. Raja, તમને profession choose કરતા નથી આવડતું. આ તમારા જુઓ, તમારા ક્લાસમેટ, તમારા ફલાણા ભાઈ, આજે જો કઈ મર્સિડીઝમાં ફરે છે, તમે મારુતિ 800માં તમે એસી પણ નથી નખાવ્યું. But that was the fact of life. It led us to thinking, and I think the times have changed. That time there was only 3 hospitals in the city of Mumbai. There was Bombay Hospital and just because Hinduja Hospital came up in front of me, Lilavati came in front of me, there was nothing. But yes, they were there and there was money there, but doctors were always reluctant to say, અમારો patient ભાગી જશે તો, આ મારી પાસે નહીં આવે તો, બારે જઈને કહેશે કે આ મારું ખરાબ બોલે છે, આ પૈસાનો લાલચું છે. Those things have to be forgotten, and I 100% endorse what he says. Yes, you are paying for a service. You charge for your service. Know your worth. Be humble. Do your goodness. Do your kindness. But at the same time, don't be taken for a ride by people who care. The same people who pay you less probably will go out and say, "Murak છે કાંઈ આવડતું જ નથી." And they come for a second opinion and third opinion, and you are looking at their mercy, what they will do to you. But things have changed undoubtedly. I mean, there are certain doctors, there are certain hospitals, there are certain places, and plus the whole country, the way India is coming up, has taught us a value. Once upon a time, if you recall, that 64 crore rupees scam was the biggest ever heard. Today now we are talking about 30,000 crore scams. So that value also has changed. So I think finance is an important part and must be addressed to, and not just put it under the carpet.
I think one very important little plot that you told me, you gave that much amount of service in East Africa, and you, as a result of that free service and as a result of that selfless service, you saw many patients coming to you. So my next question is to Dr. Nidhi. Like many old-timers, consultants say that reputation is the best form of marketing. I'll come to a different topic right now. Reputation is the best form of marketing, and you wait till the patients come via word of mouth. But in 2026, a young doctor who is competing with AI-driven clinics and aggressive social media ads, is waiting for word of mouth still a viable business strategy or not, according to you?
Yes, so as the old timers say, reputation is the best marketing strategy. So in this method of practice, patients come to you because you have proved your ability to treat the patient successfully. And slowly the patients will come because by the word of mouth publicity, right? But it is a slow process and it will have long-term results. But eventually they come because they have faith in you. Clinical competence and bedside manners and everything, it is still, it gives a very strong brand value, right? But for example, now there's a young doctor and wants to start practice, but in a location where many people may not know him. So if he sits quietly and like waits for patients to come, that may not work for him. So in those cases, he may resort to social media and AI-driven strategies. So in both the cases, in one there is people come by word of mouth publicity, and in the other one because of social media marketing. But reputation still remains as a core currency in medicine. So if you go by the first method, the growth might be slow. But then for the second one, again, you can't completely rely on it because AI clinics and ads, people still trust other patients, not ads. And AI clinics cannot actually replace trust yet. So what we can do is find a smart middle ground
Balance between.
that is not aggressive marketing and not quietly waiting. Instead, have reputation amplified visibility.
Right.
So for that, you can have like ethical digital visibility, no gimmicks, no fake claims, Google Map reviews with like real patients, and most important is the skill, excellent clinical work. Let your work speak for you. So reputation and light ethical digital presence will be very powerful. And yeah, so trust builds slowly, but visibility will accelerate it.
Right, right. So yeah, I think what everybody keeps talking about unanimously on this panel is the importance of ethics and how we should not be giving them up. But Dr. Himanshu, I'll ask you a very interesting question. Most doctors would never cross that unethical red line. But tell me something, isn't that red line moving every year? In the sense, what was considered over investigation 10 years ago is now often labeled defensive medicine. So are we hiding our revenue needs behind the shield of medical legal safety?
Very honest question and really interesting question. First of all, I would like to congratulate Satish Bhai and team and LIBF for organizing such an excellent session for doctors, and heartily congratulate. Over investigation and medical legal litigations, it is like a rat race, according to me. I just want to give you one example. In US and UK, many of the friends were practicing, and they say if the patients say you thank you, and at last they will say see you. Means see you, they, behind the court they will see you. So my mean to say is, doctor should smart enough to protect himself and avoid silliness in emotions. You should be practical enough, you should be very skillful, and you should be very intelligent in every aspect as a medical legal prospectus. Because I'm just giving you one example. Many a times patients say now in AI era and all this digital media marketing, if you are, I'm an ENT surgeon, and if I say patient by tuning fork test that you are having sensory neural hearing loss, and if I not order the audiometry, honestly it is a crime, because you have to, your clinical skill is good, but on paper you should have deafness to prove. And if you are not doing these things, in spite that you are thinking that patient should not spend 600 rupees, he is poor, and we should see by our clinical knowledge that he is having SN loss, why should we go for the audiometry? Then it may lead to trouble to you. So enough not over investigation, enough investigation should be done to prove. Diagnostic skill is a different thing. You are having diagnostic skill in Dr. Raja's era, patients having full faith on doctor that you are having, you do not require knee replacement, you are having arthritis, you just take this medicine and all, it will be fine. This is the world will work. But in 2026, world definitely works second to the this you can say evidence. So it is evidence-based medicine. So I am not emphasizing on over investigation, but I always say enough investigation should be done before proceeding to anything.
So you find a way to make sure that even the unaffording patients can do the basic minimum investigations so that we don't end up under any kind of legal scanner, or even for that matter, even the patient does not have any kind of future problems.
Yes, because if you are doing endoscopic sinus surgery on patient, and if you are not ordering CT scan nowadays, it is crime.
So
according to
get it done from a charitable or a low profile diagnostic center, but get it done. That's the point.
Another thing, foreign body bronchus. We are operating too much patients of foreign body bronchus by only just ausculting chest. We can say this air entry is less on the right side or left side. Patient having coughing, not responding to medicines. He should have pediatrician refer us with medicines and not treated with the enough medical line of treatment failed, then we go for the bronchoscopy. We know that, but still we go for the CT thorax to rule out the foreign body nowadays. I'm just giving you a short example. We removed plastic whistle. We removed plastic whistle stuck in the airway of a child for 7 years. Patient had a history of plastic vessel engulfment. Patient belongs to Sutrapada district, Gir Somnath, in periphery. Treated by physician. History of engulfment of plastic vessel at the age of 3 years. In pediatrician file, they written that it will come out in stool, don't worry. Now the thing, most important with your connection with your question, investigation. More than 2 lakhs rupees wasted for the investigation, many a times X-ray chest, every 3 months pneumonia treatment, asthma treatment, AKT has been started. Still patient, relatives insisting on that thing that when my child running, there is a whistling sound from his chest. So very honest advice to junior doctors as well as in any doctor. Clinical, I always say questions are never silly, answer could be silly. Listen patient properly. Give your enough time. By just asking the question, you can narrate thousands of things from patient. He's wake complain, he's running and he's whistling. You see. And this patient, we removed plastic whistle after 7 years from his airway, from windpipe. He survived. This is God bless. Wonderful. This is miracle.
Wonderful, wonderful, actually.
And we don't do miracle, we just do the CT scan and it proved that there is a plastic vessel in the airway. If I didn't do CT scan in this child, again he was roaming around for 10 years again.
Yeah, true.
So this is the requirement, and investigation should not be over-investigated, but it should be done enough way.
And had you not done the CT scan and he would have gone to someone else, that
He did the
person would
CT
have
scan.
done, then you would have landed in
yeah.
trouble.
So medical legal aspect, honestly speaking, when when in our medical legal conference, one very renowned personality from the Supreme Court, he said, medical legal aspect and doctor, nowadays it's very critical time to doctor to protect himself. Nobody will protect you. You should not make a blunder, because law is also answerable to society. If you forget something, seizure in someone's stomach, it is crime. But if you misdiagnose by not doing investigation, it is again crime.
Yeah.
Thank you.
True.
So in another word, less is more is not true.
Yeah.
You know, it should be enough.
It should be just enough, yeah.
Can I just add? Patient could not afford the investigations is not acceptable defense in the court of law.
Very true. And it has written in the medical legal book also, you cannot justify, and one more thing. If you are working in government setup and you are doing free of treatment to patient, and in court of law, you misdiagnose if you are doing gross negligence or if you are doing something, lawyer will ask you only single question. Doctor, this patient requires CT scan. You should say yes, because it is written in book. Then why not? You cannot say the patient is poor and I am thinking that it doesn't require CT scan. You misdiagnose. You have plenty of opportunity to send the patient for CT scan in a lower rates. So rate and investigation disproportionate.
So irrespective of whether our practice is sustainable or not, we need to set a baseline level of ethical care.
100%.
Clinical.
Yeah.
Dr. Mayur, today is the age of mediclaim policies. And I think most of us, even in the audience, would have mediclaim policies. Is there a tendency amongst doctors to over-investigate or over-treat a patient just because the patient has mediclaim and does not need to pay directly from his own pocket?
So this is a good question, because most of them, I think around 70-80% of people might be having mediclaims nowadays. So as sir said, that over-investigation, over-treatment pertaining to mediclaim. But the thing is that mediclaim, definitely there are approval agencies or third-party administrators who approve the mediclaim policies. So they require adequate investigations to support your diagnosis, what you are thinking that the patient is having, what disease he is having, and what is your management plan, for how many days are you going to admit him, or those all overviews can be given if you have adequate investigation and you have full knowledge about the disease what the patient is having. So now, for example, if a patient is having stroke, he has a paralysis attack, he is a hypertensive, he is diabetic, but his stroke can be caused because of this heart illness, so cardiac illness. So cardiac workup will be required in that particular. So you order those investigations. But patient might feel that it is over investigating. I have brain disease, why are you investigating my heart?
Yeah.
So this is all miscommunication from the doctor's side. So they should adequately communicate that this is the thing which you are having, this is your disease, this is the cause of your disease. So these are all the possibilities which can cause this disease. So we have to investigate adequately. So in order to rule out what is the exact cause. So as we say in our medical language, that differential diagnosis. If you have a particular disease, these are the 3-4 possibilities which can be the cause for this particular thing. So we have to investigate in order to rule out each one of those causes. And Mediclaim and all these agencies, definitely they require supportive investigation. So we have to investigate. There's nothing like over-investigating the Mediclaim patients. Rather, I think that those who don't have Mediclaim, they are under-investigated. Under-investigated in terms of like, as I said, cardiac workup for a stroke patient and all those things. So they'll just do an ECG. They'll not order a 2D echo or anything. And they'll just do an ECG and they'll leave. That okay, if he's not having any arrhythmia, but patient might have a recurrent stroke after few days. And regarding the stay of hospital, again, it is said like people think a Mediclaim patient is there, so the stay will extend to 10 days. And if a cash paying patient is there, the stay will go for 4-5 days and they will discharge. So there's nothing like that because it all depends upon the disease per se. Similar example, same like a stroke patient I said. So if a patient is having stroke, he may have worsening up to 2 weeks. So, but we don't admit for 2 weeks. But there is a chance that he may have worsening. Maximum chances are in first week. So at least that 1 week hospitalization is required. Again, that depends how severe is the disease, how much area is involved, how much deficit is there. So these all things, there are several parameters which matter. And on the basis of that, the doctor takes a decision. But the thing is, the only major fault here is, I think that communication is between the doctor and a patient should be proper. So we have to adequately like communicate and tell that this is the disease, these are the investigations which I like to do, and the reason for doing those investigations, and this is the management plan. And we'll see if at all you are better, there's no worsening after 5-6 days, we'll discharge. If there is any complication, the stay might extend for 2-3 days more.
Yeah.
So this is what exactly we should convey properly. And irrespective of Mediclaim or cash patient, I think the management line should be the same.
Right.
And definitely, most of the doctors, they ethically practice and they follow these guidelines. So, but I think patients have that false belief that Mediclaim patients, they'll ask how much amount policy you have, this, that and all, and everything will be exhausted. Those all things are just what are the interpretations made by some non-medical persons. So which are wrong beliefs in the mind of the patients.
I will just add
Sure,
one point
sure.
to this here. So I think after this discussion, two important points come. I will add one more, but one is a very important point is the communication.
Yeah.
Today, the doctor-patient relationship, earlier it was taken for granted. Today it is very, very fragile. It's so sensitive that if you don't disclose everything, you have hidden information. So I think a communication and a transparency is one most important thing which has to be told. And I would add to a point here, which I think the corporate hospitals have taught us, is the documentation. Don't shy away, don't run away from documentation. Whatever you have told, make sure you have documented.
Yeah.
And in that documentation, it is so very, and you can write and inform the patient. Don't simply bluntly say it is not necessary. Say under the available circumstances with your comorbidity condition, this is not advisable. So you have to now learn the language of doctor's language or a lawyer's language, whatever you call. This is where the question of protecting yourself in the society comes. So don't be rude. I had one patient who came, consulted me, paid my fees, and I said, you have nothing wrong with you. You just go. You just go home. He went outside and complained. He consulted me, he took the money and didn't do anything to me. Now, I have no answer for that. So being sometimes good is also traumatic for yourself. So you need to protect yourself in such a way that you protect and document as well. And that documentation, whether it is in the hospital, whether it is, clinic or wherever it is, and because after a couple of months when you are off guard, You will not remember your patient. But if you have a documentation in front of you, you can openly kind of protect yourself, protect patients, and avoid unnecessarily arguments, litigations, XYZ. So that is, I think, is an important
Yeah,
part.
very true.
So as you said, similar kind of an experience is there. Like if a patient comes to a neurologist, so definitely many patients come with headache. So many patients will be like, I am having a headache, I want a scan, and I have an insurance policy.
Yeah,
So
correct.
this is a common scenario which patients come. So that is like we don't misuse that insurance policy.
Yeah, that's
But
true.
if we don't order a scan, they'll go doctor shopping. So that is how things are nowadays.
So I think we should have a panel
Yeah.
discussion with patients as well on this.
Yeah, and I agree with him because sometimes you feel, even though it's not required, but patient keep on insisting, I would like to go for CT scan, MRI, PET scan, what. 2, 3 times you refuse. Another, he will went to other doctor and he will write down CT scan.
Yeah.
So it is always, Dr. Raja sir said, truly evidence-based medicine, documentation-based medicine is must to protect yourself.
Right. So friends, we began today asking if there's a conflict between good medicine and sustainable practice. And what our panelists have today shown us is that sustainability is not a dirty thing. If a doctor cannot sustain his practice, how will he treat? He cannot treat anybody. It's as simple as that. But that said, while finances do sustain a doctor's practice, ethics are still paramount. We need our practices to grow, but we also need to ensure that our integrity, our soul remains the one thing that is not for sale. Thank you to all our panelists for their calmness and their frankness. And thank you to all of you for your participation. Thank you.
Thank you. Thank you so much.
Thank you.
I would request everybody to wait. I would request Dr. Ajay Thakkar sir to please felicitate our panelist and the moderator. Like you were saying in SSC, we need to teach some things. I did my 11-12 from Somaya. Somaya में we had a topic of Gita ethics, एक subject था. So this is where we should ring the bell कि अभी थोड़ा राम बनना कम and थोड़ा कृष्ण बनना ज़्यादा ज़रूरी है.